Good evening, beautiful souls, and welcome back to the Unexpected Detour, where in life detours are inevitable. On this podcast, we talk about real journeys, we talk about healing, resilience, and many unexpected paths people travel when facing illnesses, especially breast cancer. As someone who has personally walked through a breast cancer diagnosis, I believe something deeply important: knowledge empowers us. When we understand more about the science of cancer and the treatments available, we become better advocates for ourselves and for those we love. Today, I want to talk about a treatment that many people have never heard about, yet it represents an incredibly fascinating approach in cancer care. It's called photodynamic therapy, often referred to as PDT. What makes it so interesting is this: it uses light to destroy cancer cells. Yes, light. Photodynamic therapy is a treatment that combines three elements working together. First, a light sensitive medication. Second, a specific wavelength of light. Third, oxygen inside the body's cells. Individually, these things do very little, but when they are brought together in the correct sequence, they trigger a chemical reaction that can destroy abnormal cells, including cancer cells. It might sound futuristic, but photodynamic therapy has actually been studied for decades and continues to evolve as researchers search for more targeted and less invasive ways to treat disease. Let's walk through how this therapy works in simple terms. The process begins with the medication called photosynthesizer. This drug is introduced into the body, usually through an injection. Once in the bloodstream, it travels throughout the body. However, the medication tends to collect more in abnormal or cancerous cells than in healthy cells. Doctors then wait anywhere from several hours to a couple of days. This waiting period allows the medication to concentrate in the targeted tissue. Next comes the most unique part of this treatment. A doctor shines a specific wavelength of light directly onto the area where the abnormal cells are located. This light may be developed through lasers, LED lights, or fiber optic devices, depending on where the treatment is being applied. When the light activates the medication, something remarkable happens. The drug reacts with oxygen inside the cells and produces highly reactive oxygen molecules. These molecules damage important structures within the cancer cells, including their membranes and internal components. Over time, those damaged cells die. One of the reasons researchers are excited about photodynamic therapy is because it can be very targeted. Unlike treatments that circulate throughout the entire body, PDT focus primarily on the specific area where the light is applied. This means that surrounding healthy tissue may experience less damage compared to some other treatments. Scientists may study how this therapy might be used to destroy cancer cells directly, shrink tumors blocking organs, reduce symptoms caused by tumors, potentially help the immune system recognize cancer cells. Currently, photodynamic therapy has been used in certain cancers, including skin cancer, lung cancers, and even esophageal cancers. Researchers continue exploring how similar approaches may be adapted to other types of cancer in the future. Whenever we discuss medical treatments, it's very important to say something clearly. Every cancer diagnosis is unique. Every patient's body responds differently. Treatment decisions should always be guided by qualified medical professionals who understand the patient's full medical history. The purpose of conversations like this is not to replace medical advice. Instead, is to help people understand the landscape of cancer research and the many ways scientists are working to improve treatment options. Knowledge removes fear, understanding replaces confusion. One thing I have learned through my own cancer journey is that the cancer community is filled with people who are searching for answers. Sometimes we hear medical terms and treatments that we do not fully understand, and that uncertainty can create anxiety. But when information is shared clearly, something powerful happens. People feel empowered. They begin asking better questions. They become more informed partners in their own care. Education is one of the greatest forms of advocacy. And that is one of the reasons I created this podcast. Cancer treatment has evolved dramatically over the decades. There was once a time when many of the treatments we know today did not even exist. Yet through research, dedication, and scientific discovery, new possibilities continue to emerge. Photodynamic therapy reminds us that sometimes solutions come from unexpected places, even something as simple and powerful as light. And that feels fitting for this podcast because on the road of the unexpected detour, light often appears in moments we least expect it. Thank you for joining me today. And if this episode helped you understand something new, please consider sharing it with someone who may benefit from this information. Until next time, take care of yourself and remember that even one of life's unexpected detours there's always a path forward.